and welcome to one of our tutorials on the ICRS Patient Registry. Today we're going to show you how you can direct your patients to enroll in the registry. There are two ways we can do this. The first is via the QR code, which will take them directly to the patient portal. Now, this QR code has been disseminated to you by email. However, if you can't find this or didn't get the email, then please contact me directly so that I can send that to you so that you can print out or use it in your clinics. The other way that you can direct patients to the portal is by telling them to access the website. So patients should be directed to cartilage.org, where they can then click on For Patients. And this will open a page with a lot of information that the patients can read about. The place that they want to be directed to is the ICRS Registry button, which is the big yellow button here. And once they click on this, they will reach the portal. So this is a longer way of accessing the portal than if they were using the QR code, which would send them directly to this page. The first thing that patients will probably want to do when they access this is to change the language to their preferred language. So it will automatically be in English, but there's a number of languages that they can choose from on the right-hand side of the screen here. And for the purposes of this tutorial, I'm going to keep this in English. So then they'll be asked to click to begin. Now, it'll start off by trying to find a patient's record. So if the patient is already in the system, for example, if you've enrolled them previously yourselves, or if they've enrolled themselves previously, then it will identify their records at this stage. For the purposes of this tutorial, I'm going to create a new patient. So I'm going to start by filling this in. So I'll put in a made-up person. So now I'll just put in my name and surname. And it'll be asked to identify the consultant. So if you are enrolling or if you're asking your patients to enroll themselves, please make sure they know who their surgeon or consultant is. And then they should click on the pathway and declare that they are not a robot. And then they can continue. So then they'll be asked to set up a question which will be used when they next log into the system. So the login to the portal will be exactly the same place as the enrollment, so they can go through the website or using the QR code. So I will just make this up. And now they're registered on the system. So they'll then be asked to click next, where they can fill in some information about themselves. So the email address is probably the most important thing that we would want them to have, because with this email address, the system can send out updates to the patient when they need to fill in their questionnaires. So this means that you don't have to do that yourself. They don't have to add any more information if they don't want to or don't have the information. But I would tell them to keep this as a yes in terms of reminding them to fill out the scores. And then they will be presented with the consent form. And this is written in all of the languages that the portal has been translated into, and has been written to the highest standard as well, and can be used internationally. So they can read this information and then agree. Now you'll see this is the dashboard that they will get to, and there's a big red exclamation mark here, which suggests that there's something that they haven't finished. So these are the questionnaires that they have to complete. So I'll just run through these very quickly, just so that you can see what it looks like for the patients. So I'll just fill these in. And as you can see, the question that they click on depends on which follow-on questions they get. So in this example, say that it's playing tennis. So no previous surgery. And if they click previous surgery, they have the option to add details. And you'll see that they are asked to put in some information on their height and weight. So this question is important because it decides whether or not to add in the Kujala score. So here is the EQ5D. So here I'll just click through these very quickly so you can see what the patient would see. This is the visual analog score. And we're now onto the KU score. So as you can see, this is very simple for the patient to fill in. There's very little work involved. You'll see that the questions turn from red to black. So all of the red questions are mandatory questions. And if the patient decides that they don't have time to finish, then the system will save the progress that they've made so far. And the next time they sign in, they can then finish from where they started. So they don't have to start again with the questionnaires. Okay, so now you'll see that all of the questions have been completed. And if they return to the portal homepage, then there's a big tick here. So that's all the patient needs to do when they enroll themselves and to put in the baseline data. So then they can quit. And if they want to sign back in to fill in later prompts, they can do it in exactly the same portal. Now, what I will show you now to finish is that this patient's information is now visible in the portal for you as a clinician or as a delegate. So if you sign into your dashboard, you can search for a patient using this magnifying glass or also the same icon on the left-hand side of the screen. And if you search for the patient, then you will find them here. So I can click on this patient. And the bits in red are things that you should be filling in, and there'll be other tutorials to show you how to do that. However, what I want to show you now is that you can see the patient's outcome scores listed here. So these are the outcome scores that they have just filled in. So that is how you can ask your patients to enroll themselves for the registry and how you can visualize the information that they have just put in about themselves. If you want further information on how to complete the clinician's clinical assessment or the information about the procedure or the treatment that you give to the patient, please watch our other tutorials. Thank you very much.